Welcome to Tuesday's coverage of COVID-19. The daily tally has noted a slight decline, but the death toll remains at a record high, with 24 losses of lives today as well. Now, against this backdrop, there are growing concerns about the rampant burnout among healthcare workers across the globe. We have more on that later on in the program. Here first is our Kwon Soa with the broader pandemic coverage. Now, Soa, there's been a drop in cases here in Korea today.
Yes, Sunny, we are actually seeing a drop for the second straight day with 869 cases reported this Tuesday. But still, the number of domestic transmissions stands at above 800. And if we take a look at the recent developments, cases have been between 800, above 800, and even close to 1,100 at times, with the average of daily cases in the past week standing in the high 900s. And with that, the country now has over 51,400 infections in total. And we're also seeing rising death tolls. 24 patients have died in the span of 24 hours. We also have some 14,800 people in quarantine. However, according to officials, the number of people that are waiting at home before getting hospitalized is actually on the decline. And if we take a look at our map now here in the metropolitan region, for instance, there are 248 people as of this Tuesday who have to wait over a day before getting hospitalized. But that is quite a drop from almost 600 on December 17th. Now we see that all 17 provinces and major cities have been affected by new cases this Tuesday, also with many in the double digits.
Right, so which is why authorities have come up with additional prevention measures ahead of the end of year, right?
Right, Sunny. Following the tougher measures that have been announced in the metropolitan region on Monday, this Tuesday, the government announced special antivirus measures that will be in effect nationwide from December 24th, so Christmas Eve, until January 3rd. So basically, these measures will kick off a day after the extra measures in the Greater Seoul area. But it includes similar restrictions. First, no more than 4 people can eat together at restaurants, and private gatherings are also strongly advised to be held in groups of less than 5. Sampling of foods and drinks at department stores and large supermarkets will be prohibited, while temperature checks must be carried out at those places as well. Winter sports venues such as ski resorts and skating rinks will be closed regardless of the level of social distancing measures. And the same goes for a number of popular tourist attractions. And here are some words from the Health Ministry.
We cannot allow regional authorities to maintain relaxed measures in their own jurisdictions when the current outbreak is spreading nationwide. I am fully aware that the new restrictions will cause many inconveniences, such as people not being able to use certain venues or hotel bookings being cancelled. We ask for your understanding and urge you to cancel your travel plans and stay at home.
Now, Christmas season is also going to be tough, not for Korea alone, but also for other countries around the world. So let's take a look at the countries with the 20th highest number of infections. In Western countries, many European countries, in fact, are canceling their winter plans, but also they are on high alert due to the recent mutation of the virus in the UK, which now currently has over 2 million cases and added over 33,000 infections in the span of a day. And also the US has added some 200,000 new cases, and over 40 countries currently have banned travel to and from the UK. And with that, the total number around the world stands at 77.7 million, and almost 10,000 fatalities have been reported in just a day. And those are the updates I have for now, but I'll be back after the government briefing. Sunny?
All right, so thank you for that. I'll see you back at the desk. Now, for more on the new restrictions on social gatherings to mark the end of year here in the country, I have our Kim Ji-yeon in the studio. Welcome, Ji-yeon.
Good to be here.
Jian, do start by telling us about the latest prevention measures.
Sure. Municipal governments in the capital, Seoul, Incheon, and Gyeonggi-do province announced a new administrative order on Monday to ban gatherings of 5 or more people in their regions. The strident restriction on assembly is to last until January 3rd, and it comes in a time usually considered a peak season for year-end gatherings and events in Korea. The measure is aimed at trying to reduce the risk of infection during the winter season as people tend to gather and crowd indoors. And today, the measure was expanded for the rest of the country starting Thursday on Christmas Eve. The move is considered the most severe social distancing measure seen so far this year. It's stronger than under the highest level 3 social distancing scheme in which gatherings of 10 or more people are prohibited.
So, Jian, what are the...
Right now, the current state of Seoul is equivalent to the calm before the storm. If we can't curb the number of infections, the scenes in New York and London, where the streets are empty and the cities are under lockdowns, can also take place in Seoul.
Under the new measure, only gatherings of 4 or fewer people are allowed regardless of whether they're held indoors or outdoors. And it'll apply to all kinds of private gatherings, corporate workshops, as well as gatherings of family members. Exceptionally, however, wedding and funeral ceremonies, given their nature, will still be permitted as long as the number of participants is fewer than 50 in the greater Seoul area. In the capital Seoul, that number is lower at 30. Gatherings of family members that are living and registered in the same residence are also permitted to have meals together. Also, exceptions to the rule include gatherings held to execute a public duty and gatherings for running a business. Exams and surveys that could not be delayed or postponed are not applicable to this measure. For instance, the gatherings of people for the making of a movie or a TV program, stockholders meeting, military training, or carrying out a safety training of firefighters are not restricted. So the rules are mainly targeted at private gatherings and businesses can still operate.
Right, Jian, I apologize for the interruption.
No
But I was really
worries.
curious about the consequences if found violating these new restrictions on social gatherings.
Right. If you're caught, those caught violating the order, both business owners and customers are to be penalized with fines. Under the current law, that amount is not fixed yet, but under the current law enacted for the prevention of infectious diseases, business owners could be fined of up to $2,700 and can be sued for more liability for ensuing costs if confirmed cases pop up in their business entity. They also face the risk of shutting down their business following an administrative order. For users of such multi-use facility, a person currently faces a fine of around $90.
I see. What do authorities hope to gain by restricting social gatherings?
Well, authorities expect the assembly restriction to help curb the number of daily infections in Korea, which amounts to like 1,000 daily. And they call it the tweezer-style quarantine measure. And that stringent measures are focused on a particular region or places that have spawned cluster infections this past year. And this, they say, is an alternative to a nationwide lockdown that could lead to economic and psychological consequences. One of the main reasons for the government reluctant to raise the social distancing level to its highest level in the 5-year system to level 3. For the past 4 weeks, government data shows that more than 41% of cluster infections in Seoul stem from these multi-use facilities, and more than 70% of all new infections announced on Monday came from the Seoul metropolitan area, where more than a half of Korea's 52 million population resides.
Right, before you go, Jian, what's the latest with regard to shortages in the ICU beds?
Well, in the capital, Seoul, the acting Seoul mayor said out of 91 in the capital, only 4 hospital beds for the critically ill are left. He said the city is trying to get a hold of an additional 105 more by the end of this month. Also, it's to run a medical consultation service comprised of doctors of local hospitals in the capital, Seoul, for confirmed patients that are staying at home due to a shortage of hospital beds for their medical needs. So it's in a dire situation.
Obviously, like the rest of the world. All right, Jian, thank you for that report.
Thank you.
Up next, we are poised to join the regular briefing on COVID-19 here in Korea for this Tuesday. And while we wait for that to commence, here are a few reminders about some of the new prevention measures to go into effect from later this week. I understand the briefing is about to start. We'll come back to you afterwards.
Let us now begin our regular briefing for December 22nd, Tuesday, on the COVID-19 situation here in South Korea. As of today midnight, we have 824 new local infections and 45 new imported cases. And the total caseload now stands at 51,460. And yesterday, a total of 108,000 cases of tests have been conducted daily, and 773 people have been discharged, while 14,810 people remain in quarantine. And there are 281 patients with critical conditions, and we had 24 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. And as of today midnight, here are some major updates on our domestic infections, so we will go over these by facilities. And first of all, starting off with religious facilities in Daegu, Donggu District, we have confirmed our first index case, and we have additional of 30 patients, increasing the total to 31. And in relation to one in the Jeju City, we have a total of 112 confirmed cases so far. And next, in relation to nursing hospitals and medical facilities, in Seoul's Gurogu District, in relation to a nursing hospital, we have a total of 107 patients being confirmed to date. And in Gyeonggi-do Province, Ujeongbu City, in relation to a daycare center, we also identified 10 additional patients. And in total, we have 11 patients being confirmed to date. And in Chungbuk, in relation to a nursing hospital, we have 71 additional cases being confirmed. And also in Chungbuk, in relation to Gwaesan, Eumseong County, in relation to a hospital there, we have a total of 28 more cases being confirmed. A total of 86 have been confirmed to date. And in Gwangju City, in relation to a nursing hospital in Bukgu District, we have 17 additional cases being confirmed. And moving to our major business operations first, in both of them are in Incheon City, and in relation to a logistics center in Incheon City, we have 8 additional cases being confirmed. And also in relation to a food processing company, we have 17 confirmed cases being confirmed to date. And also in relation to elementary school in Gangwon Donghae City, we have 45 additional patients. And also in Gangwon-do District, in relation to a family gathering, we have 10 cases. And in Cheongbuk, Cheongsong, we have also a social gathering where 13 confirmed cases have been confirmed to date. And as we have reiterated for the past week, on a weekly basis, we have about 50 new cluster infections on average. And during the past week, especially, that is starting from the 13th of December to the 19th, and we have identified that 71.2% of the total cases were related to religious facilities, nursing hospitals, or business operations. And in particular, a month ago, when in our 45th week, which was the 22nd of November to 28th of November, compared to then, right now we are seeing a rapid surge, more than 2 times of these cluster infections stemming from these facilities. So we would like to note that we need to curb further spread at these facilities, and this is why we need to switch to non-face-to-face means at religious gatherings, and also we need to refrain from having social gatherings and group meals as well. And we need to take particular precautions and comply with quarantine measures as well within the nursing hospitals. And it is also very important to wear face masks at all times, and also have non-face-to-face means when having meetings or gatherings, and also having this person get tested if anyone shows symptoms. So these are highlighted once again. And lately, we have also the safety e-report run by the Safety Ministry, and under this application, we have also carried out a pan-government inspection, and especially for the these places of worship for the religious facilities. People had gatherings, and also people did not wear face masks properly at multi-use facilities, including restaurants, and also at large-scale grocery stores. People did not wear face masks on a regular basis properly, and also they had a weak compliance to these quarantine measures, and these same were also found at rest areas on highways. And also as for our R&D process, as for remdesivir, we have administered the drug to a total of 1,094 patients across some 9 dozen hospitals here in South Korea. And as for the clinical trials for our vaccines here in Korea, we have the 4 vaccine candidates. So 2 of them are DNA related, and also we have one also of being the composite, the candidates as well. And these are carried out, these clinical trials are carried out on a first phase. And we believe that starting from next year until next first half of next year, we aim to complete our phase 3 trials. And in the morning, during the 11 a.m. briefing, the quarantine authorities have revealed and rolled out detailed measures for the special year-end quarantine measures. And here are some summary. First of all, as for the nursing hospitals, we will be having more regular testings, massive testings. We will also have a stricter control on the number of visitors, as well as a banning of all private gatherings as for the people who are working there. And nationwide, we will have the level 2.5 level social distancing for the religious facilities. We will ban all small gatherings, as well as physical services as well. And we also need to ban also all of the use of the winter leisure facilities. And we are strongly recommending that you should refrain from having social gatherings, parties, or group meals with over 5 people. And also at restaurants, we need to ban these gatherings involving more than 5 people. And also at party rooms, which are the host venues for these group parties, we will have a gathering ban. And as for department stores and these large-scale retail shops, we will also stop the sampling of food and all other group events or gatherings, and also ban the use of resting areas as well. And in the winter, we believe that there are many people visiting the ski resorts, as well as skating rinks and other winter facilities will be closed. And also we will be minimizing the visitors at these year-end holiday attractions, and also we will prohibit and limit the room usage for the lodging facilities to about 50%, and this will be applied nationwide. And moreover, Seoul's Namsan Park and Gangneung's Jeongdonjin area, which are popular destinations for the year-end holidays, we will be closing these facilities, and we will be restricting the access of visitors. And the quarantine authorities will also like to note that we need to ban and we need to restrict the amount of these gatherings and travel during the year-end holidays, as they may spring up more cluster infections going forward. And we ask you to stay home safe and sound. Last but not least, here is another message from the quarantine authorities. The COVID-19 outbreak is also unveiling right now, and we believe that this is a very critical juncture that we are standing now. Even though we have seen a comparative drop week drop of the confirmed cases today, we believe that this downward trend may not be certain for the time being right now. So it is too early for us to be certain, and therefore we need to refrain from having social gatherings and year-end gatherings, and we ask you to also comply with quarantine measures. And we also like to extend our deepest appreciation to the public for your participation in quarantine measures as well. And also there are many medical staff members who have been exerting their full efforts to dedicate to be working at these makeshift testing sites, and we would like to thank thank you for your dedication once again, and we hope that we need to exert our full efforts so that these trends will continue for the time being. What we are most worried about is the fact that we can have another large-scale resurgence of the viruses stemming from cluster infections involving business operations as well as religious facilities. And moreover, we are seeing a rapid surge of these fatalities in the nursing hospitals or hospitals, and they can also be very vulnerable to further infections. So we need to take particular precautions and be well prepared going forward. And aside from the quarantine authorities' guidelines, we ask for you to comply with the following three measures. First, as for religious facilities, please do not have face-to-face meetings or gatherings. And second, as for a large-scale, as for the high-risk facilities, that is involving nursing hospitals and other nursing homes, we ask you to comply with quarantine measures not only inside these facilities but also outside these facilities on a personal level, and also wear face masks and also keep hand hygiene as well. We believe that you are dedicating well to treat and to take care of these senior elderly patients. However, we ask you for your continued cooperation. And third, as for these military units as well as correctional facilities and the business operations which have seen a large massive outbreak, we ask you to comply with the basic principles of quarantine going forward. And right now, the global international community is seeing a rapid spread of the virus, and centering around the UK, we are seeing a new variant of the COVID-19 virus, and we are seeing the virus spread at another very fast pace, and we are faced with another challenge at every move, and we are exerting our full efforts to secure vaccines and to prepare for possible vaccines development here in South Korea as well. And on a daily basis, we are mounting, the fatigue is actually mounting in terms of social distancing and quarantine measures, and there are many medical staff members and healthcare providers who are exerting their full efforts. Thank you very much.
질문에 답변 드리는 시간 갖겠습니다. 거리두기 그리고 생활 방역.
Right, that was Kwon Junuk with Tuesday's afternoon briefing. So what did he have to say?
Well, first off, there were new outbreaks this Tuesday at family gatherings, religious facilities, nursing facilities, as well as an elementary school. And according to Kwon, in the past 4 weeks, on average, there were around 50 group infections. And those happened mostly at religious facilities, medical facilities, as well as business establishments. In fact, over 70%, which means compared to last month, that's around double the amount. And he also reiterated the new strict measures which have been implemented in the metropolitan region as well as nationwide. So in Seoul, Gyeonggi-do province, and Incheon beginning on Wednesday and Thursday in other parts of the country as well. So the reminder is especially that people should not gather in groups of 5 or more. And adding to what Yeon mentioned earlier, people can even get fined if they do not abide by this at restaurants. In fact, 3 million won, roughly $2,700 for business owners, and around 100,000 won or $90 for customers. And also, the nation's people should try to cooperate over the holiday season. So even although these measures seem to be complicated, the gist is try to stay at home and safe.
Right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Personal protective clothing is essential in treating COVID-19 patients, but given the prolonged pandemic, there are growing concerns about the impact of these heavy-duty apparel on healthcare workers. We explain in this report.
물 한 모금도 마실 수 없는 상태가 되니까 그게 참 불편하고 안타깝습니다.
화장실은 또 가려면 벗어야 되고 그렇기 때문에 이 옷도 계속 입고 벗고 하기도 번거로운 상황이고.
Healthcare workers fighting exhaustion under heavy protective gear has become an all too familiar sight. Most healthcare workers in the field typically wear level D protective suits. Personal protective equipment are classified from levels A to D, and D offers the minimum protection required for particulate matter, but not for hazardous chemicals and gases. Along with the use of masks, they have been effective at protecting workers from infection. But the wearers have to always battle weak air circulation, as well as exhaustion and dehydration. To save their workers from fatigue, several hospitals in Korea have began issuing more convenient and less cumbersome protective equipment.
시간이 지나면서 이제 코로나 바이러스에 대한 정보가 점점 쌓이고 코로나 바이러스의 전염 방식이라든지 바이러스의 특성들이 드러남에 따라서 그 레벨 D와 우주복처럼 입은 그 PPE는 더 이상 이제 너무 과하다.
We spoke to the CEO of a local protective equipment manufacturer to learn more about the differences between a full-on hazmat suit and the simpler coveralls.
첫 번째는 혈액이 투과가 되느냐, 두 번째는 그 바이러스가 원단을 뚫고 나오느냐, 세 번째는 액체, 비말이 차단이 되느냐, 네 번째가 공기가 차단이 되느냐, 이 네 가지를 갖다 기본적으로 실험을 하고 테스트를 받고 인증을 받고 있습니다. 이 방역복이나 가운 둘 다 그런 테스트는 기본적으로 다 통과를 해야 돼요.
Full protective suits are also more difficult to wear, taking 4 minutes to get into, as opposed to just a minute for protective coveralls. And this is not including the time it takes to put on gloves, masks, goggles, and face shields. In the case of coveralls, however, some parts of the wearer's body, including their neck and legs, are left exposed.
전신 방역복을 입게 되면 뭐 묻을 곳이 없잖아요. 완전히 닿는 곳을 최소화시키니까. 그러니까 그렇게 코로나 환자가 100% 있는 곳에서는 당연히 전신 방역복을 입어야 된다고 생각을 하고요.
Hospitals had long called for simplified personal safety equipment to help workers preserve their energy and provide better care for COVID-19 patients.
4종 세트를 입으면은 손의 감각도 예민하게 유지를 할 수가 있고 몸이 가벼우니까 환자 안전에 더 신경을 쓸 수가 있죠. 그리고 의사소통이 자유로워지고 응급 상황일 때 제일 극명하게 차이가 났었는데 레벨 D를 입고 가야 될 상황에서는 최소한 5분에서 10분이 걸렸습니다. 들어가서 환자를 진료하는 데까지. 그렇지만 4종 세트를 입고 시작하고부터는 1분 이내에 들어갈 수 있죠.
Hospital nurses, who often have to tend to patients around the clock, have echoed these needs as well.
그렇지 않아도 부족한 간호 인력을 과도한 방호복 착용으로 소진시키는 것은 매우 안타까운 일입니다. 단지 대부분의 의료진들이 4종 세트는 감염에 대한 안정성이 검증되지 않아 우려하고 있습니다. 통기성 방호복의 보급과 4종 세트로도 업무 수행에 충분한 안전을 보장할 수 있다면
The medical sector is in urgent need of a solution to prevent fatigue and burnout among healthcare workers and keep them going in the long fight against COVID-19.
서울시청의 선별검사소 운영을 위해 긴급하게 의사협회에 도움을 요청하였습니다. 그런데 1시간 만에 지원자가 모두 오셔서 임시 선별검사소에 필요한 30명의 의료원이 금세 충원되었습니다.
1년이 다 돼가고 있는데 언젠가는 끝나겠지 하면서 계속 버텼는데
의료인과 역학조사관을 포함한 지자체 공무원들도 번아웃 될 정도로 힘든 상황에 있습니다.
Today, we discuss the plight faced by healthcare workers amid an overwhelming surge in COVID-19 cases across the globe and also explore ways to ease their hardships. I have Dr. David Kwak from Suncheonang University Hospital. Welcome back, Dr. Kwak.
Good afternoon.
And I also have Professor Lee Hoon Sang from Yonsei University. Good to see you again, Professor Lee.
Thank you for having me.
Now, Dr. Kwak, I understand you're also devoting your time at one of the many temporary screening centres set up in the metropolitan region. Could you share with us your experience as a healthcare worker tackling this unsettling third wave here in the country?
Well, I do take part in taking a shift to go into the screening center and doing all the medical consultations and treatment if that's necessary to the people who are first coming into the screening center. Since a few weeks back, we've started noticing a number of people wanting to be tested has increased dramatically. And among those, we have also started picking up random positive cases that did not realize that they had any reason to be infected with the disease. But also with the increasing numbers, obviously the people who are in there to test those people are wearing out. Obviously the nurses that has to conduct all the tests for themselves, and also the doctors that have that they also take shifts to go in and consult the patients. We're beginning to wear ourselves out. And also the fact that because more the numbers of the people that has to be tested also requires further numbers of medical personnel to conduct all the testings and also the consultations. So we have gotten ourselves to take more numbers of shifts per month as we came into this month particularly. So I think it's starting to take a toll on ourselves as medical personnel. But also the fact that because with the dramatic increase in the numbers, we've also started to be more careful letting people into the hospital, meaning we started also seeing way more people because they had overlapping symptoms with COVID-19 that had to be consulted outside of the hospital at a screening center. And so it's taking a toll not just in the way that it's wearing the medical personnel out, but it's also the fact that people who needed to be seen by a proper specialist inside the hospital are now being checked by a general practitioner or people who are taking shifts at the screening center for their symptoms while they're outside. And some people had to actually wait a few days until they had a proper testing done that they were found negative to get into the hospital to be checked properly for their symptoms. So that's what's really happening in reality at our hospital right now.
I see. And staying with what Dr. Kwak has just said, Professor Lee, does the local healthcare system have sufficient staff members to cope with this latest outbreak?
So until about a month ago, Korea had been doing quite well in responding to the situation. So there had not been a problem of a stark shortage, but lately with a very rapidly increasing number of the COVID-19 patients, especially now we are seeing about 1,000 confirmed patients per day. So I think we are slowly experiencing the level of shortage to many of the facilities, such as residential treatment centers and screening center as well. So while there had not been much of the patients confirmed cases happening, maybe that might not have been the problem. But I'm not sure if the Korean government has been quite effective in preparing the surge capacity to respond to current surge of the patient cases happening as of now.
Right. Elsewhere, medical workers in the US are also working around the clock to fight the world's worst outbreak. Now, for more on the situation there, I have Dr. Vin Gupta at the University of Washington joining me now. Hello, Dr. Gupta.
Hi, good morning.
Right, Doctor, as a medical professional yourself, Dr. Gupta, what can you tell us about the situation on the ground there and about the toughest challenges faced by healthcare workers over in the US?
You know, unfortunately here in the United States, and thank you for having me, we have an out of control outbreak across the country, and we've been facing this since March. And it's gone through dips and waves, of course, but what we've noticed now is really the limits of our healthcare system being stretched. And by that I mean, as an ICU doc, I can say this, really the limitation in providing quality care for our patients across the country is not, do we have a ventilator or do we have a dialysis machine? It's, do we have the right the appropriately trained physician or nurse or respiratory therapist available to provide care for our patients? And so that is the critical bottleneck here. It's having enough staff to care for patients in a situation that's frankly out of control. we're seeing anywhere from 2,500 to 3,000 deaths a day, 200,000 cases a day. We expect it to get worse January into February, and we don't think vaccination, while it's ramping up, is really going to impact our lived reality over the next 60 to 90 days. So it's a really tough situation, and I think particularly difficult because we're all fatigued, both here in the States and worldwide.
That's true. Professor Lee, I believe you have a question for Dr. Gupta.
So as you have said, it seems like in the United States right now, there seems to be a very high number of the patients happening right now, and especially with the severely ill COVID-19 patients mounting up in the United States now. What is the situation to tackle the issues to provide ICU beds, which seems to be in critical shortage in federal level or in the national, in the state level?
Dr. Lee, thank you for that question. You know, it's state by state. There's a different approach. So in California, you may have seen that ICU bed capacity is essentially all but gone. And so Governor Newsom and his administration is trying to figure out ways to increase that bed availability. You know, as mentioned, it's not just about opening up more beds, physical beds, but how do we get the right type of healthcare worker to actually care for these patients that will fill these beds? That's harder. So there's a focus on trying to bring out retirees who might have some skills in critical care medicine, actually graduating earlier, medical students. I mean, this is the desperate situation we find ourselves in. What we're not noticing is governors saying, can you help us from across the country? The way that New York State, for example, reached out to the country to see if there are volunteers that could help that state and New York City specifically when they were going through their time of need by eliminating cross-state licensure requirements so that, you know, me as an ICU doctor in Seattle could just hop on a plane and go to New York City on a moment's notice. That type of initiative is not there right now because I think governors are concerned that if we take away resources from one part of the country, are we actually going to cause a crisis there while we're trying to address our own? So this is a really tough situation. Really, the only way out of this situation is continued adherence to masking, distancing. We're begging people not to travel for the holidays. We think that's been a big source of, unfortunately, case spikes. And then, of course, the vaccine, which is not going to get us out of the current mess, but is hopefully going to be the relief we need in the near term.
Right, it's better being safe than sorry at this particular moment then. Dr. Kwok, I believe you also have a question that you'd like to ask Dr. Gupta.
Yes. Dr. Gupta, thank you for sharing your valuable time with us to share your knowledge and experience. So as the world knows, U.S. began administering the vaccines since last week to the most exposed, probably the people of the country. And I believe on a live television, you also received a shot of your own. Can you share with us your experience of receiving the vaccine and tell us about your thoughts?
Of course. I was privileged as one of NBC News's medical analysts to take that opportunity and that platform to hopefully lead by example. And so, as an ICU doctor, I was given priority access, and the stars aligned for that opportunity to reach out to really materialize. I had a really good experience with the vaccine. I received the Pfizer vaccine that was sort of jointly developed by Pfizer and BioNTech, and I didn't have any problems with it. I received the vaccine in my left upper arm. I had some soreness in there for about 24 hours, and that was it. I didn't have a fever. I didn't have a headache. I otherwise felt really well. I was monitored for about 15 minutes after that vaccine administration. And I'm looking forward to my second dose, which I understand will be also on air on the Today Show on January 6th. So what we're trying to do here is encourage people to get the vaccine because it's safe for the vast majority of individuals. It's beyond a doubt it's safe. And we know it's effective because, Dr. Kwok, as you know, COVID-19 in its worst impacts can result in anybody, whether they're young with no pre-existing conditions or old with several pre-existing conditions, you can still end up in the ICU. And this vaccine is really, really good at preventing people from ending up with severe illness that requires them to be in the ICU. So we're really hoping to lead by example here across the country, that this vaccine is safe, it's effective, whether it's Pfizer or Moderna or what have you. And as many of us that can do this publicly as possible, I think it's going to be really important for broad buy-in and to really address vaccine hesitancy.
Now, Dr. Gupta, while you've been lucky, you've been fortunate enough not to have suffered from any side effects. What, however, are some of the most commonly reported side effects for those who have not been as fortunate?
You know, so the common things being common, it's generally injection site soreness or some degree of redness, low-grade fevers, mild headaches that generally resolve within 24 hours. So those are the common side effects. And overwhelmingly, that is what, if somebody is to experience an adverse event, that's one of those adverse events. So let's be clear. In the very rare circumstance, and we've heard this because it's gotten a lot of press attention, individuals, sometimes expected, sometimes unexpected, have experienced an allergic reaction that's severe. It's called anaphylactic type allergic reaction to this virus, to this vaccine. And what does that mean? That means that either they can develop something called hives, which is a skin rash, or they can develop shortness of breath, or some combination of a severe allergic reaction where you get shortness of breath or you feel faint or you have a skin rash. Really, it can depend on the individual. That's exceedingly rare. There's only a few examples of that out of tens of thousands of individuals who have been studied and or who have received the vaccine. So we should not focus too much on those cases. We should recognize that they can happen and prepare ourselves and make sure that we administer vaccines in safe settings. But we should focus on the pros of this vaccine, which are that it's broadly safe, broadly effective, and we can manage the adverse events when they happen.
All right, Dr. Gupta, thank you very much for your insights and for making the time to join us live with your thoughts at this hour.
Thank you.
Right, back here on the local front, Professor Lee, in addition to the challenge of securing more ICU beds, is the task of ensuring trained staff members, as Dr. Gupta has mentioned, is the case over in the US. What are your thoughts on this?
So I think we are facing with a similar challenging career right now as well, because at the moment with the increasing number of the confirmed cases, with which also comes there are situations with the increasing number of the severe cases as well. So the government is actually working with the 17 national university hospitals and 42 tertiary level hospitals to prepare critical care beds. And so far, the government had been securing about 318 critical care beds. They would be ready by December 26th. But the problem is the manning all those beds with the medical personnel. With this kind of new beds that is coming up, even though we have the physical space, coming up with all those personnel will not be easy because those people will have to come from somewhere, from some of the hospitals. And also, even though the government is actually recently the Ministry of Health had been considering securing some of the recent university graduates, especially by allowing them to take the university the medical licensure exams. The graduation exams, which had been somewhat controversial, but those young doctors would not be readily available, especially for this kind of a critical care setting. So the problem will continue on. Currently, the government is asking for retired nurses to volunteer themselves, but the rate of the preparing them to the necessary capacity will take some time.
I see. Dr. Kwak, meanwhile, the failure to address the burnout in the meantime among these healthcare workers surely will ultimately affect patient care. Do you care to elaborate on this, or do you agree with this?
Well, I do agree because it requires a certain specialist to actually go in and treat the COVID-19 patients. It's not like every single doctors are able to just go straight into the ICU and start caring for the patients. It requires certain specialty, certain knowledge. So that's definitely taking tolls on those who have been working on COVID-19 patients since the beginning. It's those a few numbers of specialists that have been treating COVID-19 patients all along. And now they're being extracted to go into social distancing centers and whatnot to care for even further more patients. And other doctors and medical personnel are being allocated to different places right now. That also we have to consider. While we're doing that, some of the patients who had to see the infectious specialist or nephrologist, those patients, those medical personnel who would be allocated to other places, there have been patients who needed to see those medical personnel. So we need to come up with a quick idea to better allocate people to appropriate places and still have the patients who are not COVID-19 patients but still need to be treated see the appropriate doctors as well.
Right. Professor Lee, some politicians are calling for the distribution of self-testing kits to allow people to test themselves at home in a bid to ease perhaps the burden on healthcare workers. Is this a feasible plan?
I think at this moment that is a little bit controversial because even though we have rapid diagnostic kit available, the problem is getting the swab because it takes a little bit of a special technique to get the nasal and throat swab from the very deep part of the nose, nasal area and the throat areas. So even though the use of the actual testing kit might be easy, but taking the sample through the swapping process will not be easy. So that is somewhat controversial. And also another aspect is even though you take so much of the testing, if there are an increasing number of the possible positive cases, the problem, I think more of the problem is getting the bed capacity readily be available. So I think maybe more of the priority should be on the securing ICU beds, critical care beds, and also the personnel to man and treat all those patients.
Right. All right, Professor Lee, as always, thank you very much for your thoughts. And Dr. Kwak, thank you for being with us today.
My pleasure.
Right, while it is with little doubt a fact that patients and healthcare professionals are bearing the brunt of the pandemic, there are many more people working behind the front lines to ensure that the virus stays at bay. Now, it is perhaps this united effort that will take us a step closer to the light at the end of the tunnel in the very near future. Thank you for watching.